You should be able to see my screen now. I'm David Wortley. The picture that I've shown there is deliberate. It is actually me, or it's an avatar of mine. And it's just an illustration of some of the things that you can do with AI. And some of these things will be relevant to my presentation. I actually rather like this picture of me because it makes me look younger, probably more handsome, a little bit more interesting. So, going on to the topic, the impact of AI and immersive technologies on the future. I want to begin by just going back, and I apologize if any of you think this is very simplistic, but I'm trying to make the point that people's conception of nursing has changed over the years. And many people involved in nursing today, particularly female nurses, may well have started off being inspired to want to become a nurse when they were children by playing games, dressing up as nurses, etc. But the world we live in today is very different from those dreams. So today, I really want to look at some of the challenges that we all face, not just in the nursing profession, but in almost every single profession that is impacted by artificial intelligence. In the UK, and I'm sure it's the same all over the world, we really face challenging times. And part of that has been as a result of COVID-19. And so public health services all over the world are under extreme pressure. And this is exacerbated by some of the challenges of the aging society and the effects that loneliness and social isolation have on people's health and well-being. So looking at those challenges, we're living longer. Now that is a good thing, but unfortunately, as we age, we tend to need more medical care. I'm extremely lucky. I'm 75 years old, so I'm in the elderly person category. Unfortunately, I don't take any medication. I walk 5 miles every day, and touch wood, I am very healthy. But generally speaking, most people of my age increasingly need medical care. And there are fewer working people in the population to be able to pay their taxes and support the care that's needed for the elderly. And this results, certainly in the UK, the elderly care tends to be underfunded. And again, it's exacerbated by the effect of pandemics. So what we're seeing in the UK as one of the Aging Society challenges, and a way of addressing this challenge, is that elderly care is shifting away from the family towards the community. So whereas in many cultures in the world, older people are still looked after by the family, they still live in a family home, in the developed world, in the UK and many other countries, the atomic family means that children, when they finish their education, tend to move away from home. And so care in the family is not the same as it was when I was growing up. It's tended to shift away from the responsibility of the family towards the community. And an example of this is my partner's father, Eric Jepson, who passed away in 2021. He spent the last year of his life living with us. And he is a prime example of the challenges of comorbidity. Although he didn't suffer from dementia, thankfully, he had multiple medical problems which required a daily drug routine. And you can see on the left-hand side of the table the drugs that he had to take, not necessarily always on a daily basis, but certainly every week. And that became the responsibility of my partner when he was living with us. But when it came towards the end of his life and he was being cared for by a nursing organisation in our house, his daily drug regime reduced down to what you see on the right hand side of the table. And one of the problems with comorbidity is not all the drugs that people take agree with each other, and sometimes they can cause problems when they interact with each other. So it's several years ago now that the chief executive of the National Health Service in the UK, Sir Simon Stevens, made it clear that we were facing a cliff edge as far as the sustainability of public health services was concerned. And this is largely from the increasing prevalence of obesity and associated clinical problems. And what he was saying is that we need to be able to shift from a mentality which is based on curing problems to preventing problems. And we need to do that as early as possible. So this means that the doctor's role is shifting away from being the solution to curing problems to taking a greater responsibility for what I call life coaching. And focusing a little bit more on preventing healthcare problems arising in the first place. And it's the same for the nursing profession. So nurses are increasingly being trained and developed as coaches for preventative healthcare. And all of this is designed to empower ordinary people to be able to manage their own personal health better. So coronavirus has made the problem significantly worse, but it's also had the effect of accelerating the digital revolution. And so there are many different applications of technology which are designed to help to overcome some of these problems. And these developments in technology have an impact on the future of nursing. So telemedicine is one of the byproducts of the COVID-19 and the digital revolution. And more people are being treated remotely, or certainly given advice remotely. And the COVID-19 has placed restrictions on physical contact, which has, of course, meant that telemedicine is more of a necessity rather than a luxury. The other effect of COVID-19 and the digital revolution is that it's seen the increasing sophistication and multiplicity of wearable technologies. Now, I started using wearable technologies for preventative healthcare in 2013, and it was a real eye-opener to me because within 3 months of acquiring my first fitness tracker to track my sleep and my calorie intake and the number of steps that I took each day, I'd lost 21 kilos. And over the intervening 13 years since then, I've come to understand that what I've been practicing in my own life has resulted in the health that I enjoy at the moment is lifestyle medicine. So, as I mentioned earlier, the care of older people has tended to shift from families to being in the community in nursing homes. And I want to just give a shout out to a lady who founded the Namaste movement. And I want to use her as an example of an inspiration of humanity and to make the point that whatever happens with artificial intelligence, it's absolutely vital that the human values and the role of nurses and their care and their human care is not replaced by artificial intelligence. So there's a range of technologies, not just artificial intelligence and machine learning, that are, it's a cocktail of technologies which include wearable devices and biometric devices that measure our bodily health and our bodily functions. All of these have to be enabled by connectivity through 5G and broadband technologies and smartphones and mobile applications, and increasingly virtual reality and simulation are used as mechanisms for digital therapeutics, as you'll see shortly. And all of these devices are connected by the Internet of Things. So what we're seeing is an increasing sophistication of the technologies that are worn or embedded in our bodies. And on the left-hand side, you can see an example of a skin patch for the future, which measures vital signs and displays those on your arm. Now, this is a proof of concept. The technology already exists to be able to do that. So increasingly, we're going to see these kinds of devices which help us to understand and monitor our own health better. On the right-hand side, you can see how digital therapeutics in the form of immersive environments can help by giving people experiences whether it's because of their age or because of their infirmity, they would not be able to enjoy otherwise. And by improving the mental health of patients, it also improves their physical health. Exercise games, are called exergames, mean that people will no longer are being treated for rehabilitation from stroke, Parkinson's disease, cardiovascular problems, etc., in specialist centres. Increasingly, they will be able to do their rehabilitation at home through the use of exercise games, which are moderated by clinical practitioners. So, lifestyle medicine, which is what I practice. I am a member of the British Society of Lifestyle Medicine, and I've recently taken a role as a non-executive director of a World Lifestyle Medicine Education Services. And it's all about how we improve health through person-centered techniques that are clinically validated to influence behavior change. And this is based on three principles. The first is that everyone is unique, and our health is not just a factor of our genetics, but it's also related to the socio-economic determinants of health, where we live, what our family situation is, our whether we live in the country or the city, and so on. And the other second is proven techniques. We need to be able to validate the techniques that are used to support people with their lifestyle changes. And this at the heart of all of this is understanding the 6 pillars of lifestyle medicine, which are healthy eating, mental well-being, healthy relationships, exercise and physical activity, minimizing harmful substances such as tobacco and alcohol, and sleep. So how is this going to impact nurses? Well, it's going to have an impact on nurses, particularly with artificial intelligence, because it's going to empower nurses to be able to take on responsibilities which were previously held by higher grade practitioners. So things that were done by doctors in the past increasingly are going to be done by nurses, supported by artificial intelligence and other kinds of tactics. But these are disrupting long-established practices, and what this means is that they're not universally welcomed, because people whose jobs are going to be impacted by AI are bound to feel threatened by the impact of technology. And an example of some of the trends on the left-hand side, you'd see a traditional operating theatre with a team of people working together, collaborating on an operation. On the right-hand side, you see modern robotic surgery, where quite complex operations with high levels of accuracy can be carried out by smaller teams and people with less training, if they're supported by the right kind of technology. In the middle, you see an example, and I use this example. It's my partner, and this was little video clip was taken in Kuala Lumpur at a conference on health technologies, and in that exhibition part of the conference was a demonstrator of laparoscopic surgery training. So this is how some laparoscopic surgeons are trained by effectively playing this game. And so the idea is to be able to use the devices to remove the gallstone. And so this game uses haptic feedback, so you can actually feel what you're doing. And the idea is to be able to remove the gallstone in the shortest possible time. And I show this video is because this is my partner who has no clinical training, is very averse to technology anyway, but she was getting better results than some trainee surgeons. So it makes you think about the role of technology and human beings in the future of things like surgery. And of course, artificial intelligence, it's not just artificial intelligence, it's virtual reality that's going to have a big impact on nursing education. And here you can see the use of a headset which does a holographic display, and this changes the way in which nurses are going to be trained. But it's also important, as I mentioned earlier, is that AI should be a support to human beings, even though at current levels of technology, AI is proving to be more accurate in the diagnosis or early diagnosis of things like cancer than human beings, human radiologists. But it's important that AI doesn't take over from human beings. It's about human beings and technology collaborating together. And even that if you are providing the care remotely, as you see here, it's important that the technology that you use allows for this human contact. And here you see a physiotherapist training somebody exercising at home. So she can see the patient on her camera and she can talk to the patient. So technology and empathy are key. Workflow optimization, this is a positive impact of AI. It will help with resource planning and optimization to make sure that the resources that are already under pressure are optimized. So to reinforce what I've been trying to say all along, AI is a tool to support human beings. It must not be the ultimate arbiter of life and death. And so I use this AI generated image to illustrate the point that it shouldn't be AI that's determining the future of life and death. It should be human beings. But the good news is that certainly for the nursing profession, all of these technologies, artificial intelligence, virtual reality, etc., are likely to benefit the nursing profession substantially. Now, to summarize, we live in a world which is shifting from cure to prevention. In pandemics and COVID-19 have accelerated the use of digital technologies, and these technologies are both empowering and disruptive. So it's not a smooth path for everyone. Nurses' roles will change, and nurses will take on more responsibility for higher grade tasks. And digital therapeutics will become more into play. And digital therapeutics mean you're using digital technology to either help manage a condition or help support rehabilitation, stress management, and preventative health care. But again, to re-emphasize this, humanity and empathy must be paramount. Nurses are going to become increasingly valuable. So it's good news for the nursing profession, and God bless all of the nurses and the work they do and the care they give all throughout the world. Thank you very much for listening to me. I'm happy to take any questions you might have.